Hi, well, Dr. Mudassir Jaz here. I hope everybody is doing fine and you people are watching my YouTube channel. So I'm a psychiatrist by profession, and a couple of days ago I have passed my exam, FCPS Psychiatry. So I think doctors know that FCPS has got multiple, exams. Part one at the start of residency, then in the midway of residency, IMM again has got two parts, written as well as talks. Then at the end of the residency, you have to pass like part two, and part two itself has got three parts: written, talks, and long case. And today I'm going to talk about talks. Well, talks in psychiatry has got 16 stations. Like in every station, you come across maybe couple of psychiatrists, at times one, at times three as well. But usually you should be expecting two psychiatrists, examiners, at one station. One psychiatrist is actually like looking at the way you're answering the questions, and the other is has got a checklist and he's treating that checklist before you. So uh, the point I'm making here is it's a whole comprehensive set of exam in which you have to pass almost 80 to 90% of the stations to cross the 60% benchmark. So when it comes to our recent exam that happened 3 to 4 days ago, I need to talk about that for upcoming resident psychiatrists who are planning to appear in the exam in next maybe November, December. Yeah. So our first station was telepsychiatry. There were 16 stations, and on these 16 stations there were different aspects. Like in one station, I remember telepsychiatry, AI, lithium, SLE, bipolar, rapid cycler, eating disorder, opioid, SPSS, research, so on and so forth. I'm like sharing my experience. First station was of telepsychiatry. I remember that was my first station, and on that station, I remember Dr. very famous psychiatrist of Karachi, Dr. Vashdev. He was actually at that station, and he was a very kind person. But yeah, I remember he was uh, he was expecting a very pinpoint answer from me, like other than other options, like other questions. One question he was particularly interested in, like what is the difference between telepsychiatry and like physical consultations, the difference between virtual consultation and physical consultation in terms of like patient rights. So I was saying autonomy, I was talking about autonomy, then I was talking about justice and like beneficence and non-beneficence and so on and so forth. But he was expecting a pinpoint answer from me. So I told him that yeah, it's confidentiality, like confidentiality. He said yes, you are right, it's belatedly right, but you are right. So similarly, the next station I remember like another like psychiatrist from Peshawar, he was sitting on a station called AI. That station was like new. I didn't see such a station like in past papers. So he was expecting pinpoint answers like regarding use of AI in psychiatry, pros and cons for doctors as well as patients. So he was expecting pinpoint like answers in terms of pros and cons for doctors as well as patients. So and like at times in like I always tell my fellows, and I must suggest to my upcoming colleagues and resident psychiatrists who are working as trainees across Pakistan, I must expect from them that please make sure that you need to come up with relevant answer. At times you need to use your common sense as well, okay? Because at times you're gonna have out of these 16 stations, you're gonna have one or two stations quite out of the blue. So you need to have that skill to tackle such a situation. Like AI, so it was like I answered those questions. I made a whole story, like, sir, like this is something new. AI is new not only for doctors but also for the patients. So I see a lot of patients are being misinformed regarding a lot of therapies, regarding a lot of treatment options because of AI, so on and so forth. I was talking about cons as well as pros as well. Like pros regarding AI for patients is like you see now patients are well informed because of AI. They just give a prompt to AI, and at the end of the prompt they like get a whole set of information. So now when patient comes to you in OPD or in your ward, at times he's already well informed. So that is a good thing when it comes to AI. Bad thing is information and misinformation, go hand in hand. So if they are informed, there are also chances that they can be misinformed, okay, because of AI. So I have told him recent news as well. Like yeah, I was going through a newspaper, like online newspaper, that somebody in UK committed suicide uh, because of because he was being misinformed regarding the treatment and regarding the therapeutic alliance with the AI chatbot. Okay, so I also quoted that example as well. Similarly, for doctors, you see there are pros as well as cons. Pros is like again you can be well informed, like ChatGPT will or other AI like uh, uh, like AI websites or applications. They'll give you ready-made set of information, so they can help you uh, in clinical decision making. But the point is, you cannot leave each and everything on AI because AI is only intelligent, but it lacks human touch. Human touch is not there. So that's why. So these are the things I was talking about during that station. Although I made all these answers on the spot because I was not very well prepared regarding that station because I didn't see such a station while preparing for my exam. Then was SLE, like it was clear cut, uh, like that scenario typically says that patient has got some mouth sores and patient has got some baldness and other pain in the joints and so on and so forth. I don't know whether that patient was like simulated patient or actual patient, but I still remember that while examining that patient, the patient was saying that he's actually having pain in the joints. So that is something we need to look at because we do, in your talks don't expect that every patient is simulated patient. I don't know whether that patient was asked to answer the way he was answering or the patient was actually of SLE. But yeah, you need to look at it. Like you don't like there's a list of examinations that you must not be ignoring. Okay. Then comes lithium. I remember there is another examination on examination of lithium. Okay, so that is something new because although we have done some examinations of patients, practice some stations on patient who is taking carbamazepine, patient who is taking valproate, so on and so forth. So I didn't do precisely some station with lithium, but yeah, when I went to that station, I just looked at the scenario, and it took me at least one minute to like make a whole hierarchy of things that I will gonna see during examination. I just kept in mind. I remember some some side effects of lithium, and then I started. And there was something very very odd that I need to share. That when I asked the patient, "Assalamu alaikum, आपका नाम क्या है?" and just I said that thing, and his hands were just in front of me, okay, just in front of me. So there was something, there was like a hint that I need to look at his hands, and I need to start from his hands. So that's what I did. I started from his hands and pulse and blood pressure and so on and so forth throughout his body. movement. And like you see lithium, you need to look at tremors. Like there are two things that you must be looking at, thyroid examination, like different points of thyroid examination, then a cerebellar examination, as well as some history regarding like urine output or something. Okay, and then at the end of your examination you need to make the patient walk as well. Then fourth station was about, I remember, um, parietal lobe examination. So that was simple. Like people who are preparing for this exam, they know that they've practiced that station a lot of times. So yeah, I've practiced it maybe 3 or 4 times. That's why I did that examination very well. Parietal lobe is something that deals with our, you know, our motor coordinated movements. Like if somebody has got some problem in the parietal lobe, they're gonna have apraxia, they're gonna have right, left disorientation, agnosia, hemineglect, so on and so forth. So you need to look at these things, a lot of things. Okay. Then comes next station was rapid cycling bipolar disorder. So in that station again, in such examination, you don't expect that in every station you need to follow a very like one size fits all model approach. No, you cannot do that. I remember on rapid cycler examination, rapid cycler station, uh, like the examiner was expecting a pinpoint answer. Like he was saying, डॉक्टर साहब इस पाकिस्तान की कॉन्टेक्स्ट में इस तरह का पेशेंट जब आएगा तो क्या करोगे? Okay, I'll go for second generation antipsychotics. Okay, other options: mood stabilizers. Valproate is a good choice. Okay, if patient is not getting well on these things, what you gonna do? And patient is agitated. Despite patient has got sleep issues, patient has got mood issues, patient has got other issues, and despite giving a lot of medications, patient is still not getting well, and patient is agitated and he is threatening the patients around him. So in such a scenario, what will you do? Then I said that, sir, I will go for rapid tranquilization. He said, what will you use? What are you using in your daily routine? I said, sir, I'll go for haloperidol and he said, at what dose of haloperidol? I said, 5 mg to 10 mg IM. He said, okay. So at times they'll ask about typical guidelines-based answer. At times they'll ask about what will you do in the Pakistani context, in the current context. So yeah, that's how you move on. Then next is about Tourette syndrome. I remember that scenario was about a young uh, boy of 88 years old, and he was having tics maybe from 6 to 8 months. So pinpoint diagnosis of that thing was transient tic disorder. And once I answered that question, actually I was supposed to consult the mother of that patient. Patient was not there, only mother was present, so I need to talk to the mother and I need to answer her queries, and along with that I need to answer some viva questions from the examiner as well, because the examiner was saying that, yeah, what is the difference between transient tic and chronic tic, what is the difference between Tourette's, what are the questions you're going to ask from patient to differentiate between Tourette's and tics and so on and so forth. So I was just saying that uh, I was talking to my colleagues after exam that station doesn't mean that you need to just at times of course you need to follow a checklist and they'll just mark it, but at times they do ask questions. Okay, so make sure that you're very well prepared regarding every you know every topic. Then next thing was about pregnant female on lithium and valproate management and counseling. So this was, I mean, aid station. Next of the aid station I'll do in the next video. But in today's video, I was just doing first aid stations, just to keep the length of this video short. Okay. So the fifth station, eighth station was female, pregnant female on lithium and valproate. Okay, so that was although not that much tough, but he was answering these questions like क्या कितने परसेंटेज है, कितने चांसेस हैं गलत रेट के उसके कोई बच्चे में कोई फीचर्स में कोई साइड इफेक्ट्स आएंगे, कोई टेट्रोजेनिक इफेक्ट्स आएंगे, कितने परसेंट चांस है लिथियम के. ही was just interested in pinpoint statistics, so that was tough. Yeah, but overall the point here is that when you're going for your talks exams, you are very well prepared regarding every station, because at times you're gonna have, out of 16 stations there is a possibility that there are some stations, there may be one or two that are quite out of the blue. Okay, so you need to perform really well in other stations, rest of 14 stations. Let's suppose two stations are tough, very tough, and you don't have knowledge or like practice of those stations. So in 14 stations, you must be doing something extraordinary, at least to cross 60% marks. Okay, so that was the gist of like this is today's video is about 8 stations about talks, and tomorrow I'll gonna discuss the rest of the 8 stations. Okay, so make sure you people are watching it carefully, and if you people have any questions you can ask. Okay, thank you.